So when we think about the vasomotor symptoms of menopause, we think about replacing the estrogen. Of course, if they have a uterus, a progesterone too for safety issues, but also progesterone can be helpful for insomnia issues and other kinds of things. But let's just get into the big taboo, capital T, testosterone. It's not really a taboo, not in my world, but in many people's worlds it still is. And they're very leery about dabbling in the testosterone pool. Tell us a little bit more about the importance of testosterone or how it's used, if it is used in women, what your experience has been with it.
Yeah, we're at the tip of the iceberg on this. This is going to start getting big, I think. And you got to step back. Did you learn in medical school that women had more testosterone in their bodies than estrogen?
No.
I did not. I learned that about 3 years ago. The reason he doesn't even look that way in the labs, because they're measured and like one's picograms per milliliter and one's deciliter per blah, blah, blah. So that you actually have to do the conversion. So I did the conversion on my labs. And unless you're pregnant, because that's a pretty high estrogen level, at all times you have more testosterone in your body than estrogen. If you Google testosterone, it says the male hormone on Google. Like, we have a branding problem with this hormone. We gendered hormones and it's hurting us. It's going to continue to hurt us. Also, men have estrogen and they have problems when their estrogen goes down. Fascinating article on blocking men's estrogen and seeing what happens. So we all have these hormones just in variable amounts. Women have more testosterone than estrogen, just on average about 10% the amount of testosterone that a man's body has. So that's where you have to start. Because if I come hot and heavy in being like, oh my God, you should give women testosterone, it sounds insane unless you back up and understand the physiology of bodies. So we say ovaries make estrogen. That's what we learned. Ovaries make androgens, which get converted to estrogens. You cannot have an estrogen molecule without it passing through one of two androgens in our bodies. That also helps us understand why testosterone is important, right? So testosterone will go a little slower down after menopause, but there is a role for testosterone in perimenopause as well. I've treated a lot of women who are not quite done with their periods with testosterone. The acceptable, air quotes, acceptable reason to give a postmenopausal woman testosterone is low desire. That's a whole bunch of bias. Why is the only reason for a woman to have testosterone to make her want to sleep with somebody? Like, once you sit and meditate on that, it is insanity, right? Like, that's a nice perk, but is that the only legitimate reason? Same thing I do with sex, same thing I do with menopause, same thing I'm doing with testosterone. Deep dive into the literature. We've been giving women testosterone since the 1940s. This stuff has been around for a very long time. We've given it to try to treat breast cancer with it. We've got data that say it decreases your risk of breast cancer. We've given it to women post-breast cancer. We've got tons of testosterone data. Yet here we are in a country that does not have an FDA-approved testosterone product because of the FDA saying we need years more of safety data compared to a man's testosterone product to prove safety. We have gender bias in what it takes to get a product approved. So we're pushed into using an off-label product. We can use a man's testosterone gel, dose it appropriately for women, or we have to do compounded, or we have to do pellets. People would argue pellets are super therapeutic. So you're going to get a lot more side effects. Some people get benefits. Some people do very well at those higher testosterones. But you're seeing a lot more side effects than if you could appropriately dose a testosterone product with something that was FDA approved.